The wrong form or dose of ashwagandha can make your anxiety worse. So let's talk about the benefits, side effects, dangerous interactions, what happens with too much, and what happens when you stop. I'm Dr. Air, quadruple board certified psychiatrist and anxiety specialist. I recommend ashwagandha to some patients, but for others, I tell them to stop. I'll explain why. But first, let's start with what ashwagandha actually is. Ashwagandha is not just a wellness trend. It's a medicinal root used for over 3,000 years and one of the most studied herbs in the world. It's an adaptogen. That's what gets thrown around constantly, so let me give you a real picture. Imagine your nervous system has a volume knob. For most people with chronic anxiety, that knob is stuck at 8 or 9. Everything feels louder. Your brain is scanning for threats that aren't there. Ashwagandha doesn't turn off the volume. It helps recalibrate the knob so normal things stop registering as emergencies. It works on your HPA axis, your body's stress command center, regulating cortisol output and your system's reactivity to triggers. Here's what it is not. Not a sedative, not like Xanax. It does not work in an hour. This is a slow systemic shift, and that's what makes it powerful. In a minute, I'll show you the research and why it doesn't work for so many people who have tried it. Let me tell you about the patient I'll call Sarah, 46, high-pressure job, 3 kids, caring for an aging mother across the country. Her anxiety wasn't dramatic, it was relentless. A low hum that never turned off, waking up in the middle of the night with her mind racing, wired but exhausted. She had tried therapy, breathing exercises, and cutting out caffeine. Nothing worked. She didn't want SSRIs, so her naturopath suggested ashwagandha. She took it every day for 3 weeks. Nothing. When she came to my clinic, she asked, "Is this real or am I buying an expensive placebo?" Here's what I told her. Multiple clinical trials confirm that ashwagandha reduces anxiety. In 2026, researchers conducted a meta-analysis. Think of it as a study of studies. Instead of running just one experiment, they gathered 22 experiments that had already been conducted and analyzed all the results together. When they combined everything they found, the conclusion was clear. Ashwagandha supplements help people feel significantly less anxious. Clinically, I see this commonly, especially in adults over 40 who have accumulated stress for years. For women in perimenopause or menopause, hormonal shifts make the nervous system even more reactive. As an adaptogen, ashwagandha can help with this. So the research is real, but Sarah wasn't getting any of it. The reason is the most important thing I'll say today, because this is where most people get it wrong. So every study showing how ashwagandha works use standardized extracts, verified to contain a specific percentage of the active compounds called withanolide. Research doses tend to range from 300 to 600 milligrams daily, standardized to at least 2.5 to 5% withanolides. Also, a daily dose of 300 to 600 milligrams of ashwagandha root extract, standardized to 5% withanolides, is provisionally recommended for generalized anxiety disorder by an international task force from the World Federation of Societies of Biological Psychiatry and the Canadian Network for Mood and Anxiety Treatments. Now, the withanolide picture is more complex than a single percentage. Most commonly studied extracts use 5% withanolides at 300 to 600 milligrams. Some trials have used extracts as low as 2.5% withanolides and still found benefits. Newer research suggests that the type of withanolide matters as much as the total content. Specifically, withanolide glycosides appear to have significantly better bioavailability than other forms. So the standardization in ashwagandha product is not one size fits all. The quality and type of withanolides matter too. Now, walk into any grocery store, flip a bottle over. You'll typically find 125 milligrams of ashwagandha root powder. No standardization, no withanolide percentage, no third-party testing. That product and the one used in clinical trials are not the same thing. They share a name, that's about it. The supplement industry has minimal FDA oversight, so what's on the label may not necessarily be what's in the bottle. It could be underdosed, the wrong part of the plant may have been used, or a non-active form of the herb may have been utilized. This could be the reason why Sarah felt nothing. So here's what to look for in your ashwagandha supplement. Standardized extract, at least 2.5% with phenolides, certified by NSF, USP, or consumer lab. Sarah switched to a pharmaceutical grade extract, 300 milligrams twice daily. By week 3, her Sunday night dread was quieter. By week 4, she was sleeping through the night for the first time in months. But Sarah's outcome is not everyone's outcome. What I'm about to say next is what most supplement companies don't educate you about enough: side effects. Most supplement videos spend most of their ads on the benefits and rattle off mild side effects for just a few seconds at the end. You deserve to know more. So let's talk about possible adverse reactions. Ashwagandha appears to be well tolerated for up to 3 months of use, but its long-term safety is less well documented. Side effects include 1. Drowsiness and sedation. This means ashwagandha can be calming for someone who's wired and struggling with insomnia. 2. Stomach distress. Nausea, cramping, loose stools, especially on an empty stomach. These effects tend to be mild, however. 3. Thyroid stimulation. Ashwagandha modestly increases T4 levels but has no significant effect on T3 in most populations. The effect appears most pronounced in individuals with subclinical hypothyroidism. If you're on thyroid medication, it can push levels up, leading to racing heart, jitteriness, and insomnia. This is the exact opposite of your goal. So your doctor needs to know what medications you're on. 4. Liver injury. This is rare but documented. There are case reports of liver damage at high doses or with prolonged use. This is one reason I recommend cycling rather than taking it indefinitely. 5. Immune activation. Ashwagandha may boost your immune system. For most people, that sounds like a good thing. But if you have an autoimmune disease like lupus, MS, rheumatoid arthritis, or a thyroid condition, your immune system is already overactive and attacking your own body. Adding something that revs it up further could trigger a flare-up. We don't have solid proof that this happens, but the concern makes enough biological sense that caution is smart. If you want to try it, do it with your doctor's guidance and watch closely for any changes in your symptoms. Some experts also advise against the use of ashwagandha by women who are pregnant and by men with hormone-sensitive prostate cancer. When it comes to supplements, it is important to remember that natural does not mean harmless. There is also the possibility of drug interactions. Even though these interactions appear limited, they still warrant caution. Medications with potential interactions include thyroid medications, benzodiazepines, immunosuppressants, anti-diabetic medications, and antihypertensives. Ashwagandha isn't addictive, but stopping abruptly after months of use could lead to increased anxiety, poor sleep, and irritability. This is one of the reasons why it is recommended to cycle this medication: 6 to 8 weeks on, 1 to 2 weeks off. This prevents tolerance and rebound. Insomnia is one of the most common complaints that people experience before or after ashwagandha. To improve your sleep naturally, download my free sleep guide in the description below. And if you'd like help with other root causes of anxiety, you'll want to watch the next video.